Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. And I'm Jasila Mujib, your host for today. As we all know, infections are a common part of our life. Infections can be either viral or bacterial. The bacterial infections are treated with antibiotics. But the overuse or misuse of antibiotics may lead to a condition called antibiotic resistance. Today we will be discussing about the science behind antibiotic resistance and also about viral infections. And the doctor joining us today is Dr. Ghada Yusuf from Al Hilal Hospital, Adliya. So Doctor, welcome to the show.
Thank you so much for having me here. I am Dr. Ghada Yusuf from Al Hilal Medical Center located in Adliya.
Okay Doctor, thank you for being with us today. And so Doctor, one of the main reasons patients visit you is with flu. Can you explain about it in detail?
Okay, so flu is actually a short form of influenza. So they just cut it down from influenza to flu. And it's usually caused by a viral infection. And the influenza, there are many types for it. There is from type A to type D. The most common is type A and type B that we're seeing in our OPDs. So usually we diagnose it with an influenza rapid test, and the way it's transmitted between people is usually when someone sneezes close to you or is coughing next to you, and yeah.
Now our topic is the viral infections and bacterial infections. So what is the difference between viral infection and the bacterial infection, and how important is it to know about this during treatment?
So the viral infection and bacterial infection, they both present the same way. So the symptoms are runny nose, an irritating nasal block, cough which might be dry or with phlegm, fever, generalized body pain, and even fatigue. So it's very similar. So the main thing that distinguishes between those two for us is during when we do a physical examination. When we talk about the onset, for bacterial infections, we see it gradually becoming worsen. So it does not come suddenly compared to a viral infection. I've had patients who would be totally normal the previous day, they're perfectly fine, and then suddenly they get up and they feel a stuffy nose, fever. I usually would suspect a viral infection. But for a bacterial infection, it will be gradual. You will start off with a runny nose, and then slowly it's worsening with a fever, and the fever is nonstop, and that's when I suspect a bacterial infection. And during physical examination, we would check the throat. So whenever you go visit the clinic, you will see us look at the throat mostly. For a bacterial infection, you will see a bit of white patches on the tonsils. Whereas viral infections, you might see most of a redness, inflamed picture. So that also helps us distinguish between those two. And when it comes to the cough, the doctor might ask you, is there a phlegm with the cough? What is the color? Is it dry? So this one usually helps us distinguish between those two. So other than that, when it's a bacterial infection, obviously we have to give an antibiotic. But you have to visit your doctor when you go there, because not all antibiotics work for the same bacteria. So that's when the doctor comes in and helps you figure that one out. And for viral infections, we have antivirals that we can give. But for the most part, it can be treated symptomatically, meaning you don't need anything else but supportive treatment and hydration, rest, and taking care of your food intake, meaning you have to eat a balanced meal too. So that's how we distinguish.
So, what are the misconceptions about the antibiotics the patients have when they visit you?
So the biggest misconception I would say is many assume that taking antibiotics would help with their common flu. As we had established earlier, the flu is an influenza, which is a virus. And using an antibiotic won't help at all with the situation. It actually might even get worse. Just supportive treatment would be suffice. The second misconception, if you are treated with an antibiotic and there are evidence that you have a bacterial infection done by your doctor, some patients would not complete their antibiotic course. They would feel that if they feel better, they don't need to take the antibiotics anymore. And that's not true, because if the doctor gives you, for example, a course of 5 to 7 days, depending on your condition. So you have to finish that 5 to 7 days. If you stop, let's say in day 2, and you're feeling better, you don't need it anymore, you might actually contribute to the antibiotic resistance and also might get the infection worse because you're not eradicating the bacteria. And not only will you make it worse for yourself, and it's also for the future when antibiotics is given to you, it won't work anymore because you haven't completed your course. The bacteria becomes, like, it changes and becomes stronger where its antibiotics won't be working on it. So yeah, that's the main 2 misconceptions. The third misconception I would say is using those antibiotics for later. So some patients might think, oh, I had the same symptoms I had last time, so I'm going to use it again. No. As I said, they both can come with the same symptoms. So you have to go to your doctor and make sure what you're having, either a viral infection or a bacterial infection.
Doctor, what are the potential dangers of taking antibiotics without prescription? Please make it more clear for us.
So the main misconception is antibiotic resistance. So what is antibiotic resistance? It's when a bacteria changes and becomes stronger to withhold the antibiotic effects on it. And when that happens, antibiotic becomes basically useless. It's not going to work on it anymore. And it becomes a whole problem where every type of antibiotic you give, it won't work anymore. And we don't really have so many antibiotics, maybe hundreds, we don't have those. So with time, as you age and continue misusing the antibiotic, it will get to a point where not even one antibiotic will work anymore. I've had a patient just a few days ago, a very lovely old lady. She's in her 60s, and she came for an urinary tract infection. And when we tried treating her with an antibiotic, it did not work. So we started doing some cultures. So cultures is when you can check whether the antibiotic you're giving has any resistance or sensitivity. When it has a sensitivity, it means it will work on that bacteria. And it baffled all of us when it was almost every bacteria has a resistance to the antibiotics, and it was a bit hard for her to get treated. So a lot of investigations went into that. So just to avoid that kind of problems, we usually try to limit the antibiotic use, especially when you get older. It's going to be harder for you to get treated. The second dangers would be adverse effect, okay? And when you take antibiotic without consulting a doctor, you might have an allergic reaction. Some people don't realize that some antibiotics are related to other antibiotics or have the similar name and you don't realize that they're the same. So some people are penicillin allergic. When they are penicillin allergic, there are some antibiotics they're not allowed to take, as this may cause a very dangerous anaphylactic reaction that will close up the throat, have breathing difficulties, and we really try to avoid from that happening. The second would be when you're taking so much antibiotic to a point that it also attacks your good bacteria. In our body, we have good bacteria and a bad bacteria. The good bacteria in our gut helps us, metabolize the food that we take in. And because antibiotic will target bacteria in general, it will also attack your good bacteria. And when that happens, the bad bacteria might overcome your gut motility and all these things, and it will cause something called Clostridium difficile. And it's also very dangerous as it might cause you to have diarrhea, life-threatening diarrhea actually, and you need to get treated immediately. So with that in mind, we have to be really careful with taking antibiotics.
You already mentioned that some of the viral infections will subside by themselves. So when should a patient with viral infection visit a doctor?
So if you're having just a simple runny nose, fever, mild fever, you can go to your nearest pharmacy and use some over-the-counter medicines like paracetamol, Fludrex, and Flutab, and it will usually subside. Of course, you have to take into account that you have to stay hydrated, well rested, and even if you're not feeling 100 out of 100, you still have to try to do some exercise or yoga, something to move your body. You can't just sit at home and lay down and not do anything. You have to try to move your body even if you're not feeling well. With time, you will see an improvement. So you don't really have to visit the doctor's OPD. But if you have alarming symptoms, as in the fever is not subsiding, you're having rashes around your body, you're feeling too drained to even walk, that's when I would advise to go see the doctor just to have everything evaluated and seen.
Now, with the rise of antibiotic resistance, can you suggest some measures to promote responsible antibiotic use?
I would recommend awareness firstly, because once everyone understands that there is something called an antibiotic resistance, a lot of people will not pressure their doctor to prescribe them an antibiotic. A lot of health organizations lately have been putting out campaigns on this matter, as we're seeing more and more problems with antibiotic resistance, especially in the elderly. The second would be education. Make the patient understand why antibiotic is not going to help them at all, or what are the risk factors and adverse effects that might be caused by the antibiotic. Yes.
How can we improve our immunity naturally?
So the first thing I would recommend is being more aware on what you're taking in. So the food you're taking in is very important, as a balanced meal can help with your immunity by a tenfold. And if you're feeling that you're not having enough nutrients in your food, make sure you go talk with your doctor so you get all your labs done, and take a multivitamin recommended by your doctor. Also, exercise. A lot of people have been on the couch or sitting around when back then it's usually people going out, having fun, moving their body, doing exercise. Exercise helps with immunity as well, and also helps to have a better physical health. So that would be the main thing I would recommend to help improve your immunity, because in the end, you are the one who can make your immunity better.
As individuals, how can we reduce the spread of viral infections especially in high-risk environments like hospitals and schools?
So I would recommend for people to have a good hand hygiene, and also have a distance from people when you're not feeling well. So as I said, transmission is usually through sneezing, coughing. So when you do have a slight symptom, please wear a mask and stay away from people who have the symptoms, even just the slightest sneeze. Try to stay away from them.
So doctor, finally, what is your advice to our viewers who is watching this program?
I would advise, when visiting your doctor, try bringing a list of questions that you might have for your doctor, because people tend to forget what they wanted to ask. And when you do visit your doctor, try bringing your medications that you take. If you have any chronic illnesses, bring the list of medications, since sometimes the doctor don't have that list with them in their EMR. So try doing that, and never be afraid to ask questions. If you have questions that you want to ask your doctor that you're not sure about your health, please do ask, since we're here to help. We're not here to just, treat your symptoms. So if you have any questions, don't hesitate to ask questions as well. That would be my advice.
Thank you, Doctor.
Thank you.
Thank you once again. So viewers, antibiotic resistance is one of the most pressing global health threats today. So I hope this talk show was helpful. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.